Hi, my name is Elizabeth, and I am an EMDR certified therapist. And I wanted to tell you a little bit today about what EMDR is, what it helps with, and what a session with me might look like. So, the first thing is EMDR is an acronym. Stands for Eye Movement Desensitization and Reprocessing. And I know that that's a mouthful, so we will break it down a little bit. And so essentially what that is eye movement desensitization. You are using your eyes to look back and forth at something that we call bilateral stimulation. More on that in another video. Um, in order to allow the two hemispheres of your brain, the two sides of your brain, to connect and communicate better so that you can reprocess trauma. So you can feel less reactive to memories of trauma or adverse experiences. And I really want to stress that here that trauma is defined broadly as far as EMDR. It isn't necessarily just for people who have been in combat or a serious accident of some kind. Might be an adverse childhood experience or life experience that we can work on in the therapy to help you feel less reactive towards it and to cope with it better in your daily life. And so that is who EMDR is most effective for. It was developed for people who have had trauma, and we have really awesome research that shows that it is one of the most effective therapies for people with trauma. The cool thing about that is that that means it's also effective for things like anxiety, substance use issues, phobias, particularly in people who've also had trauma or some kind of adverse experience. So if that sounds like you, this is probably a really great therapy for you and something that could help a lot. And so, what a session looks like is that we will start with a lot of preparation. Really, our first few sessions will be developing some coping skills, some grounding techniques, so that once we start the reprocessing, it doesn't feel overwhelming. You have the skills to pull out of it if you need to. And once we feel like that's all in place and we've assessed your readiness and you're ready to go, we will choose some targets together. So we'll choose some memories or beliefs or incidents that you want to work on in order to reprocess them and feel less reactive about them. And once we've chosen those, we'll go ahead into some reprocessing. And like I said, you'll use this bilateral stimulation by looking back and forth at the screen. I have an app that I use to do all of this online. And you don't actually have to relive or talk about the memory. You are noticing what you're noticing, and then I just ask you what you notice. And we do this over and over until your reactivity comes down, until you're able to notice and things feel a little bit calmer, a little bit less activated. Um, and we go through the targets that you want to work on. So it might take more than one session to work on a target. That is totally normal. Some targets might be resolved in one session. That's awesome too. Most people have more than one target, right? Rare people have just one incident that they want to work on in EMDR, and we can do that. But if it feels like there's a lot of memories and incidents, that's totally all right too, and we'll work through them systematically together. And we'll close the session by, making sure that you feel stabilized, and we can check in about how it all went. Then we part ways, and so that is a little bit about EMDR therapy and what it looks like with me. Feel free to reach out to me if you have any questions or want to learn more about it. Elizabeth at onemindtherapy.com. Take care.